On Tuesday morning, Vietnam recorded 2 new COVID-19 cases in Hải Dương province, raising the country's tally to 2,271. These 2 cases were F1 in the infection clusters in Cẩm Giàng and Kinh Môn districts and have already been isolated. Meanwhile, Hanoi's Department of Health announced that 1 person in Dịch Vọng Ward, Cầu Giấy district has tested positive for the coronavirus. This person was an F1 contact of a previously reported case and is already in quarantine. According to the National Steering Committee for COVID-19 Prevention and Control, in the current outbreak, 26 patients have recovered so far, and all of them are from Hải Dương. From midnight today, the 16th of February, a 15-day social distancing order has been imposed across the northern province of Hải Dương under Prime Minister's Directive number 16. People are aware of the situation and are strictly following the social distancing order with the hope of containing the pandemic as soon as possible. In the following report, we will see how the first day of social distancing is going on in Hải Dương province.
Hải Dương on the first day of social distancing. The streets are quieter. People are strictly complying with the social distancing order. Local authorities in wards, communes and residential areas continue to remind people to keep updated with the situation and adhere to social distancing measures across the whole province.
Normally, the park and streets are very busy, but this morning is much quieter. Everyone is aware of the situation and is taking the social distancing order seriously.
Tet is quieter than usual as all non-essential shops and services have been closed. People in every district, city, town, village and residential area have complied with the social distancing order.
Nhất là của tỉnh, của huyện.
Information about the pandemic situation in the province is frequently broadcast on Vietnam television. Local authorities also remind people to heighten their awareness and follow preventive measures.
Since the pandemic is unpredictable, people are staying at home and avoid visiting relatives during this time. We agree with the decision to impose social distancing here.
On Monday night, the province's functional forces urgently deployed vehicles and set up checkpoints to control entries. With urgent and drastic actions taken by the party committee and local authorities at all levels, together with the support of the people, Hải Dương will soon prevent the virus from spreading further across the province and regain control of the pandemic.
People returning to Hanoi after the Lunar New Year holiday will have to submit medical declarations. They have been divided into 2 groups. Those who have not traveled to outbreak areas and have not had contact with anyone related to COVID-19 cases will only need to submit their online medical declarations via the website tờkhaiyt.vn or the NCOV app. Meanwhile, people who have traveled to outbreak areas or localities with confirmed cases will have to visit a local medical station in person. If they fail to report themselves and cause community infections, they can be fined up to $8,600 and may be subject to criminal prosecution. All street food shops, cafes and tea stalls in Hanoi have been ordered to close from midnight Tuesday, the 16th of February, as the city steps up COVID-19 prevention. Hanoi has also postponed the reopening of historical relics after Tet. Previously, at a meeting of the Hanoi Steering Committee for COVID-19 Prevention and Control, city authorities said that new community cases have continued to emerge. As such, the risk of an outbreak remains high, especially after the Lunar New Year holiday when city dwellers return from their hometowns. Hanoi has asked all districts to focus on contact tracing, zoning and isolating F1 contacts. Local supervising groups must also keep track of people returning from outbreak areas. According to the Ministry of Health, by the end of February, Vietnam will have imported around 5 million doses of COVID-19 vaccines if flights are arranged on time and procedures are completed. Of the 5 million vaccine doses, 4.88 million doses will come from the COVAX initiatives and 117,000 doses will be purchased by Vietnam. With this total amount, the country will be able to give 5 5 million people their first jab in the first phase of vaccinations and the second jab after 3 months. Priority will be given to the 2 to 5 million people who are on the front lines of COVID-19 prevention and control.